Hi everyone, we're back here again to answer some more questions. These come from my website, and Barbara's here to join me to ask those questions. So if we'd like to kick off with the first one, Barbara.
Okay, it's from Kathy. She's 43 years old and wants to know how to treat dark circles. She did have a small amount of filler under the eye, but it hasn't improved her dark circles. She also had tear trough filler 4 years ago. Can you give her any advice?
Yes, I mean, typically dark circles under the eyes, there are a number of reasons why you might have those depending on your age. So typically she's had fillers, tear trough fillers. That's probably because she had some depression, which is one of the common causes for dark circles. How long ago did she have the fillers, did she say?
4 years ago.
So it's quite possible that those fillers have now gone. So she may need to have them repeated. But also the other thing to think about when you're having dark circles is, your health. So you need to look at dehydration, whether you've got pigmentation, whether you're asleep, you're tired. So these other factors are really part of the assessment is to see whether you're suitable to have another round of fillers, particularly when you're looking at skin integrity and laxity in those areas. So best that she sees a doctor and has a proper assessment.
Yeah, that's good advice. I mean, I have a feeling she thinks that it could last forever. She had it 4 years ago. She probably needs another round.
Typically fillers, they last anything from 6 months to 2 years. And sometimes they will last longer depending where they're placed, but generally they usually dissolve by then if they're typical sort of dermal filler, the hyaluronic acid filler.
Okay, our next question is from Denise. She recently had fillers in her marionette lines and sees a little bit of difference, but she still has a deep line on the corner of her mouth, leaving a shadow. Should she have more filler put in?
You have to be very careful in this area because if you're starting to put fillers around here, particularly in this lower half of the face, that you could quite possibly make someone look more chipmunky or bulky. So if you've got lines coming down here, there are different techniques that you can use to minimize that. So there's a technique called the fern technique, or you can use a retrograde technique where you're actually supporting the lines underneath a bit more structural, or you can be using very fine fillers, typically which we do in that area. So they are more of a skin booster type of filler. It depends how bad those wrinkles are, how deep they are. And what was the age? Did she give us an age?
She didn't give us an age.
And obviously the age is important.
Well, I'm curious. I mean, is this something you treat with all age groups, or is it more prevalent with mature patients? But do young patients come in here?
So younger patients that have this generally have a thinner face. They may have lost volume for whatever reason. Older patients will tend to get these as part of that aging process, but they'll also tend to get some mid-face dropping. So again, that's why the assessment is important, because rather than just treating this area specifically, you may be wanting to lift to correct some of this, especially in an older patient.
Yeah, that's good advice. Andrea wants to know if she can have chin fillers or chin implant. She doesn't feel she likes her side profile, which is a problem with a lot of people. She feels it makes her look slightly chubby, and she's only 120 pounds. So she's very slight. She's not overweight, but she doesn't like her chin.
So I see a lot of patients actually that have what we call a weak chin, where there's what we call where the chin appears to be lacking support here. And so typically fillers in this area are very useful for giving projection. I'm not a big fan of chin implants because obviously they tend to be permanent unless this issue here is more severe. Our faces change as we get older, so I think we don't want to put anything in there that's not going to change with us. Some of these implants become more prominent or don't look right as we get older. So, having said that, I do quite a bit of work just projecting this chin, which interestingly restores the balance throughout the face, so that if you've got what appear to be thin lips, sometimes that balance is restored just by actually treating the chin.
Your advice is so good, because a lot of these questions, you'll answer the question, however, it may be another problem. I mean, it might be the cheek that needs, or, it's not just a lower face problem. There are other problems that are causing the lower face problem.
You have to think about the face as not being isolated. Whilst we may look at certain areas or target certain areas, everything is connected. So, if you lose volume here, it will actually affect the corner of the mouth. If you lose volume here, you get a lot of changes in the lower face as well. This sort of chin area here, this submental fat, again, if you're getting volume slippage, it will contribute to this, so that when you're treating this, you may get some improvement of this chin under here, this submental area.
That's something people really need to understand. It's not just the target area.
No, everything is connected.
That's excellent, Dr. Sibthorpe. Our next question is from Renee, who's 49 years old and has wrinkles under her eyes. It's only visible when she smiles. What's the best treatment for this? Can Botox be used under the eyes, or these wrinkles need to be surgically removed?
So again, the wrinkles under the eyes, we have to be very careful what she's referring to, because if there are wrinkles around here, around the side, and just underneath slightly on this lateral aspect, then Botox typically is a good treatment in a younger person. If the wrinkles are coming into the center part here and you have other changes with laxity of skin or herniation of fat, so you get this typical eye bag, then Botox can actually make things worse. If you are an older patient and you've lost volume in this area, which will contribute to these wrinkles, then using a filler, a fine filler, correctly placed at the right depth, is probably the better solution.
Okay, very good. That's
it.
The end.
Okay, so if we do have any more questions, please go to my website and submit them through there. Thank you.